recent years there have been some really significant structural reforms to the Australian system that I think are going to create a much more streamlined and navigable framework for the delivery of social services, and that's what I'd like to briefly outline for you today. Until very recently, Medicare, Centrelink, CRS Australia, Hearing Australia, they all were delivering their own services entirely separately. So they all had their own structure, their own funding models, their own delegations and their own staff. So it wasn't until the early 2000s that CRS Australia and Hearing Australia were integrated into the Department of Human Services, and then just in 2011 we had some legislative amendments that brought Medicare and Centrelink and the Department of Human Services together. So they're all now come under the one Department of Human Services. The integration of these separate agencies delivering social protection services into one government department is a pretty significant effort at the level of central government to address the fragmented way in which social protection services have historically been delivered in Australia. And of course, this does have positive implications for government savings through efficiencies, but the integration also has important implications for how easy it is to access information and services, particularly for people who are in need of multiple services. So the most vulnerable who are most in need of a strong social protection floor. So an example of this is a new system that's been introduced called connected authentication, which is designed to help customers who have existing Medicare, so health, Centrelink, some kind of welfare and child support accounts, all access these accounts online via a single website. So it links all these three organisations together in one online space. So just to give you a really basic example, if you were a single mother and you were wanting to calculate your child support payment through the Child Support Australia organisation, you could do that at the australia.gov.au website, and at the same time you could apply for your rental assistance benefit, and at the same time you could claim back your Medicare supported visit to the doctor.